we're joined by Bernie Robinson, a registered nurse and interim provincial president of the Ontario Nurses Association. Bernie, what should the Ford government be doing here? If they were taking this seriously as a real crisis situation, what would you expect to see across this province right now?
So immediately, the government could release funding that there's millions of dollars in healthcare funding that has remained unspent. So that could be one of the initial things that they could do. It's such an unprecedented time. If there was any time to use that funding, it would be now. And the next most important thing is that he needs to step away from appealing Bill 124. We need to have an opportunity to negotiate a fair contract. And we honestly think that by doing this, we will be able to bring nurses back to the profession.
Bill 124 really limiting wages. I'm sure you've seen a wave of nurses leave the province. How much of an impact is that having on children's hospitals?
So in children's hospitals, it's an unprecedented time. There's long wait times right now, increasing volumes. Really, the children's hospitals are bursting at the seams. They've had to now transfer pediatric patients as young as 14 years and up to adult hospitals to ensure that they are getting the care that they need. These are still children who have complex systems. You're not in full adult mode at 14, and you need the specialists. You need the special care that is provided in a pediatric hospital between 14 and 18.
Now, Bernie, how does Ontario compare to other provinces across the country when it comes to this situation?
I honestly can't speak too much to that other than to say that our overcapacity at the Children's Hospital in Eastern Ontario, right now they're used to be seeing 120 patients a day. They are now seeing, the reports that I have gotten, we are seeing 110 pediatric patients each hour.
I mean, I just had to let that sink in. 110 an hour?
Yeah. It's so far over capacity that at one point their ICU was 200% over capacity. They had to open up a second pediatric ICU. You have to remember that their staffing probably was split between the two ICU units. And we may have had workers in there who were not specifically trained for ICU to care for those patients. And, our nurses in Ontario just want to do the best job they can. They need the resources to do those jobs, and they really need the support that the government should be giving them and funding.
Bernie, thank you for your time tonight on Trending Now.
Thank you very much.